Body. Today we'll be going to discuss about meningitis. It is the inflammation of the member that covers the brain and spinal cord. It happens when bacteria or viral organism travel from blood into the lining of the brain. This bacteria can be quite common. 10 in 100 adult and child carry this bacteria at the back of their throat without being ill. These are passed from person to person by coughing and sneezing. People of any age can get meningitis, but it is common in young children and babies because they do not have a fully developed immune system. Children and babies are less able to fight germs than adults. Bacterial meningitis is a very rare disease but can be very serious, requiring urgent treatment with antibiotic. Viral meningitis is commoner, but less serious, um, cannot be treated actually with antibiotics. Both have similar symptoms and test to make diagnosis. If bacterial meningitis diagnosed early and treated quickly, most children make a complete recovery. But if they're not properly treated, can cause disabilities like deafness, brain damage. So, what are the signs, symptoms that we look for these things? Um, Actually, it's very difficult initially, maybe like cold type symptoms. Um, so, we just try to give some of the mild symptoms, that is green symptoms, moderate symptoms, amber signs, and red symptoms, that is serious sign. So green symptoms like fever, cold hand, feet, refusing food, vomiting, dislike to be handled, headache, aching muscles, unusual cry, moaning, sore throat, stomach pain, diarrhea. In this case, up to visit GP, describe the child's symptoms carefully. Now about the moderate symptom, they will be drowsy, difficult to wake, floppy, pale, blotchy skin, rash or red purple spots, stiff neck, dislike of bright light, confusion or irritability, rapid breathing or grunting, and bulging frontally, that is soft part in the top of baby's head. In this case also, call or visit immediately GP's symptoms. So that time you have to immediately describe the symptoms to your GP. If GP is not available, NHS area 111, or you can go to the accident emergency of your nearest area. Now you have to know about the red flag signs. They are floppy, become floppy, seizure, unresponsive, all these things. In that case, you have to immediately call 999 or and ask for ambulance. Most distinctive feature is non-blanching rash that does not fade under pressure. We call glass test. And if your child has a rash and fever, immediately you have to take to GP. You should not wait that everything to be worsened. Now, diagnosis is actually by the examination of doctor, and then need to be doing some blood test and also talk about lumbar puncture. It is a test, is a very putting a very small needle between the bone of your backbone of the child called spine. This allows a very small sample of fluid to be taken from that area and then sent to the laboratory and tested to see if there is any bacteria present. And we decide, this bacteria decide how many days of antibiotic on one type of what type of antibiotics is needed. Now, treatment is depends upon the cause. Actually, it can be, I already mentioned, can be bacterial, can be viral. So, actually, treatment of antibiotic to be started until we blood tests and lumbar puncture tests results are available, and it is given directly into the vein, so it works very quickly. Early treatment with antibiotic essentials. So if it is not able to, feed or dehydrated, we put some saline drip. That is a thin tube inserted into the vein in their arm. Normally, child should be cared in the high dependency unit, so post monitoring of child is possible. Um, Sometimes we also use with antibiotics some steroid to reduce inflammation of the brain. In mild cases of bacteria meningitis, if treated early, child will completely recover within few weeks. There is no specific treatment for viral meningitis. Only if it is herpes simplex virus, only then we can treat with some antiviral. Now, preventive measures. How can you prevent this? Is basically vaccination against the hip meningitis, Group C, and pneumococcal disease available in UK. It is a part of routine immunization program for babies and extremely effective. These do not protect against other form of meningitis. This is also vaccine form. There is meningitis B, recently developed, but at this moment not routinely it is given. If that families with contact with a patient who has meningitis, may be prescribed an antibiotic to stop developing infection. It is important that medication is taken as directed by doctor. Other school contract like school friend um, are very rarely at high risk and do not normally need special treatment or investigation, but should be aware about the early signs of meningitis. After discharge, the doctor will see again an outpatient. Then some child recover without any after effect. The likelihood of getting after effect from meningitis depends upon the severity of the illness and the type of meningitis.
You have to go to a club. What is that rubbish things you made?